When does play therapy kind of like lose its luster?
It depends on the developmental, because you may have a kiddo that is 10, 12, but developmentally they're a little bit younger. So sometimes play therapy is still
Yeah.
effective, but usually the ages are from 3 to about 8. We're in the playroom, but we use play therapy skills with teens, with adults. There's things that we bring in to all ages.
I was just wondering that because when you said you work with teens, like, do they get resistant to play if on its face it looks like this is for a young kid or that, don't treat me like a child, like as those. But what's like an example of play therapy for an adult?
So maybe using a game or something in a session. Try that. We'd also like to use, sometimes we call it sand tray therapy. And that's kind of a type of play therapy where you use like figures to represent certain things. So like
Yeah.
we might use something like that. So it kind of gets them out of their mind a little bit, and it really helps externalize some of the things that they're coming to therapy with. Sometimes it's a lot easier to talk about if you're creating something in the sand tray and really seeing it outside of that, and it creates a safe space for that. So it can be really helpful.